Please welcome to the stage Panel 2, How Reproductive and Birth Justice Can Guide Quality Care. Serving as our moderator for this panel, Jennifer Porter, Director, Mayor's Office on Women's Policy and Initiatives. Let us receive her as she comes. Dr. Jamila Perritt, President and CEO of Physicians for Reproductive Health. Dr. Nolene Jeffers, co-chair of the National Association to Advance Black Birth. Ebony Marcel, Director of Midwifery at Community of Hope. Let us put our hands together and receive them at this time.
Thank you so much. Good afternoon, everyone. Okay, we can do much better than that. Good afternoon. Okay, thank you. So we're excited to come together today to talk about a really important topic. In 2018, DC Health released the Perinatal Health Framework. And what it did was outline the 7 priorities to eliminate preventable maternal and infant deaths. And as those priorities have been outlined, our city has been looking and investing in ways to prioritize health and move the needle on health for mothers and for infants in our city. But we know that there's more to do. And so today, I'm excited to be joined by some amazing, phenomenal speakers to talk about the importance of moving from equality to equity to justice. And so let's kick it off, shall we, ladies? Awesome. So let's just start with laying a basic ground for the definition of reproductive justice. And we'll start with you.
Absolutely. Thank you so much for having me. I'm excited to be here. I'm a DC native, and it's always my pleasure to be able to be in a space with the community that made me. I love this question because I think that we hear a lot about reproductive justice in the public space. And as the framework has gained more attention, we hear it mentioned more and more. But we rarely hear her story behind it. Reproductive justice is a framework, a theory, an ideology, a movement that was coined and created by 12 Black women in 1994 who were seeking a broader frame for talking about reproductive health in the United States during that time. And instead of using the language of choice, which really had been the predominant language in the 90s when we were talking about access to reproductive health care, they instead coined this new term, reproductive justice, which brought together human rights, social justice, and reproductive rights. And there are a couple of things that I think are really critical to know about reproductive justice that make it different and unique than reproductive health or reproductive rights. Reproductive justice is deeply grounded in a human rights framework, and that was intentional because human rights are known to be universal, indivisible, and interdependent. So that means everybody everywhere is entitled to these rights, no matter whether their gender, their income, their race. And it's also resting on centuries of Black feminist thought. So thinking back to Sojourner Truth, Mary Church Terrell, these Black women who were talking specifically about the unique experience of gendered oppression and racialized oppression in this country, and the way that created a specific and unique circumstance for Black women. One last thing I'll say about it, it's important to also understand that this was a framework, as I said, created by 12 Black women, but it really was meant to encompass the experiences of all people, recognizing that all of us live at the intersection of a number of oppressions, and it is the condition and the context of our lives that creates the experiences that we have and impacts our ability to exercise our reproductive rights.
Thank you, and thank you for that. Just breaking that down, when we hear the concept of reproductive justice, there are very different things that come to mind for different people. And we know when we talk about birth justice, we're talking about something different. Yeah. So can we talk about the genesis of birth justice?
Yes, so there are 4 core tenets for reproductive justice in the reproductive justice framework. That every person has the human right to have a child and to determine the circumstances and conditions under which they give birth. that every person has the human right to not have a child and to have the information and resources necessary to prevent or end a pregnancy. Every person has the human right to parent the children we already have in environments and communities that are safe and sustainable and free from violence from the individual or the government. And every person has the human right to exercise bodily autonomy. When we talk about birth justice shows up in that first tenet of reproductive justice, that human right to have a child and to determine the circumstances and conditions under which we give birth. When we look at the inequitable outcomes for Black women and Indigenous women and birthing people in particular, we see that this human right is in jeopardy. Many of us are dying in childbirth in the postpartum period, and birth justice really rests on saying that whatever systems and circumstances you need to thrive, certainly to live through and beyond your pregnancy, is a human right to which everyone is entitled. And I do want to invite the other panelists to, if I missed a piece or to join in, please do.
Thank you, and I think that was helpful to really frame what we're talking about today. A lot of times when we're having a conversation around maternal health, conversations in public health, we talk about the concept of respectful care. Ebony, can you talk to us a little bit about what does that mean and how is it connected to what we're talking about here today?
Sure. I really don't like that term. I'll just say that. It's a term that really continues to sugarcoat and not really address what we need to talk about. It was commonly used to describe changes that they wanted to make in maternity care overseas, but to me, that's really based on conversations about physical abuse versus here we need to talk about racism and bias and how folks are engaging in care. So I'm not a huge fan of respectful care, and I think that I'm going to continue to push the envelope to say we need to have a bigger conversation, not just say we're talking about respectful care. And I also wanted to add to Jamila's conversation, it's also about centralizing the most marginalized. And that's a huge piece of what reproductive justice is.
Thank you. Dr. Jeffers, when we talk about this concept of reproductive justice, we know that, to Ebony's point, the impact for different parts of our community are disproportionate. Can you talk a little bit about the impact of reproductive justice in our community? And I think as we discuss impact, we can also talk about the impact of the language that we use around this concept.
Absolutely. So reproductive justice, I think the strength in this framework and theory is that, as Ebony mentioned, it is centered on the needs, barriers, strengths, challenges of people that are most marginalized. So we think of that as people that are disabled, immigrants, Black people, people of color, people that are trans and non-binary. And I feel like there's a real strength in that, right? When we center the most marginalized, then we understand what are the gaps, how can we transform our care to make sure that we are promoting equitable outcomes, and through that, we can produce more just systems of care as well. Now, in terms of language, I think one thing that's really important, I don't know if you've noticed, but we're using sort of gender-inclusive language here. So we typically will say Black women and birthing people, and that's really important as well. Understanding that people come from various identities, and it's important to honor that as well in our work.
And if I could add a little bit to that, I love that, right? This understanding of centering those who are most marginalized, right? Because this, when we think back to the reproductive justice framework and its origin story, it wasn't a framework that was created by doctors or nurses or public health agents necessarily, right? But community organizers. And so what they were doing is really trying to coalesce into this grassroots approach to shifting systems and structures so that we all have an opportunity to thrive. And as an organizing principle, what we're talking about is centering the margins. And so if you build systems and structures that actually benefit those who are most marginalized from care, then everybody else on the center will naturally benefit. Our healthcare systems as they currently exist are designed to center those who already have a number of privileges. If you're insured, if you have a doctor, if you don't have any income inequities, right? If you're not struggling to actually receive your care, you will get care. But those who are on the outsides continue to struggle. And so this mobilizing and community organizing framework really prioritizes that. And this piece about language, I think, is really a challenge, I think, for lots of us, because language changes constantly. And so the language that we use today may be different than the language that we use tomorrow, next week, next month, next year. And we have to make room for that. The different ways that we think about the work, the way that we talk about the work, and the way that we hold the work. Certainly around gender identity and sexual orientation, about race, around economics, around the way that we even phrase how we're talking about community, right? So the use of people first language, not low-income people who are living on low incomes. Not marginalized communities, but communities who are marginalized. Because what it does is it helps remind us that we're talking about human beings. These are people first, and the other additional pieces of the work are often a result of oppressions that we have designed and allowed to flourish in our systems. And so it's a reminder for us to really shift our thinking as we're talking about the work, because it will force us to approach it in a different way.
Good. So, okay, we have a good working definition and understanding of it, but let's just kind of break this down. What does it mean in practice? What does reproductive justice mean in practice? And Ebony, I'll go to you because I think it's important to not only understand it, but to see it and to be able to really understand what it looks like in practice.
So there's different layers to this, and definitely I want to refer to my co-chair from NAB to discuss our Black Birthing Bill of Rights, to talk about what's important for the individual. I want to talk more so about systems. I feel like as we've been continuing to kind of tippy-toe into this difficult conversation, we keep putting a lot of energy towards the individual. And we're not going to fix anything by a couple of folks going to a bias class for 4 hours and now everything is fixed. We need to talk about our systems. And what that means is acknowledging that they're broken, acknowledging that they need to be rebuilt, acknowledging that what we have done in the past is not working, and really, really moving towards changing how we've been providing care that includes a non-biased environment, an equitable environment, an inclusive environment.
And so Ebony actually mentioned the Black Birthing Bill of Rights, and I encourage all of you to go to the website of the National Association to Advance Black Birth. In April of 2020, we disseminated a list of 20 rights that we believe that each Black birthing person is entitled to. So these rights were created and informed by evidence and also the lived experience of Black birthing people. And they cover the gamut of what is an optimal experience from pregnancy through postpartum and early parenting, including the ability to choose your care provider, the ability to have support that you choose during birth, the ability to have affordable care, to have anti-racist care, to be respected, seen as a full human being, and to have your identity respected, and to be able to make decisions for yourself and your baby. So I encourage you to take a look at the Black Birthing Bill of Rights. They're not just a list of rights for Black birthing people. Of course, it helps the person to understand what is really this optimal care that is going to help me to thrive during my childbearing year, but it's also for healthcare providers. What's the level of care that I should be giving in order to provide equitable care? And it's for healthcare institutions. Hey, how can we transform our policies, our systems, our structures so that we're more in line with making sure that we're optimizing the rights of Black birthing people?
Sure, I'll add a few words. I think that, if we take a zoom out and thinking about a broader approach to how we are hoping to address inequities in our systems, Ebony talked about the systems level issues, right? Not thinking about trying to find the individual fix. And also, Dr. Jeffers mentions this Black Birthing Bill of Rights. how do I, as an individual, advocate for myself in these systems? And so we see these improvements, these suggestions are opportunities, levers for change that are showing up in a number of spaces. It also shows up in the policy space. A lot of the work that my organization does, Physicians for Reproductive Health, really leverages the medicine and the science, the evidence that you've heard them talk about, to shift policy change. And so we've seen that really take hold, even at a federal level, with the Momnibus Act of 2021. And Representative Alma Adams and Lauren Underwood and the Black Maternal Health Caucus are pushing this legislative package of 12 bills that says just that. What does it look like if we center the margins, if we create policies and legislation that actually advocates for those who are least likely to get care? What kind of changes in our systems could we affect? And the other thing that I'd say about how it looks in clinical care, as an OBGYN and a family planning specialist, and I know as midwives, we all have trained a number of other providers, medical students, residents, fellows, nursing students, midwives, and we really have an opportunity in our training programs to flip the table over, to talk about exactly what Ebony mentioned. We're not talking about respectful care. We're talking about undoing the white supremacist and racist legacy on which our medical institutions were built. That is the beginning point. We have to really grapple with this dark and complicated history of racism in our medical care, and particularly in the reproductive health space. We don't have far to look, right? Thinking back to the names that we know, Marion Sims, right? Thinking back to the providers who bought and purchased enslaved people for the express purpose of experimentation. This is a legacy that we have to grapple with as healthcare providers. And we also must continue to teach it to the people that we've trained so that we do not repeat these atrocities as we continue to move forward.
Thank you for that. I know that when you mentioned trainees, and while we know that in training there's so many priorities and so many concerns with our community health that can be prioritized, but as we move towards a place of reproductive justice and birth justice, what are some of those additional things that individuals who are training the next generation of providers should be prioritizing?
So I mentioned that I'm from here. My grandmother has this phrase that she talks about, the come heres and the from heres, right? And often the come heres believe that they have all the solutions that the from heres, who have been here for many generations, are living through. And I mentioned that in the context of medical education because our medical education systems aren't designed to demand that you learn about the community you're charged with caring for. Right? And I think that ahistorical perspective impacts our ability to care for people. I intentionally trained in DC, went to medical school at Howard, continue to practice in this city because I believe in the people here and I care about the health of individuals here. But you don't have to be from here to be able to take good care of the folks that made me. But you do have an obligation to learn about the history of this city, about the people, the relationship of the individuals in this city to the institutions where they seek care, and how that impacts our ability to move the needle on these inequities. And I think that that's a really important place to start. What is our responsibility as healthcare providers, and what do we need to know to take good care of the folks that we serve?
And I think in education for healthcare providers, whether it's in medicine or in midwifery, it's important that we move away from sort of individual blame narratives as well. I feel like there is a lot of attention still on concepts like cultural competency, which focus on understanding sort of how to give care to specific communities, when in reality we should be teaching our students about structural competency. What are the structures in place that continue to produce inequities and injustices in our healthcare system and our reproductive healthcare system in particular? And so really our job as educators is to make sure that we're constantly helping our students to think about the structures, the systems in place, rather than thinking about individual people and putting blame on those individuals and communities.
And I just want to add what Dr. Jeffers kind of said. Sorry, that got loud. I apologize. Whoa. Just a quick understanding of what she just broke down is medical students not saying this is a Black woman and already deciding that she is full of risk and trouble and problems and attitude and possibly thicker skin, to understanding that she's a whole human that needs to be cared for, and that depending on where she is coming from, there could have been a lot of redlining, barriers, generational chronic stress that contributed to possibly why she's in the position that she's in.
And not only that, each individual, each community has strengths, opportunities. How can we capitalize on that and help them to use those strengths and those opportunities to improve care and to improve outcomes as well?
So important. And continuing this conversation with this framework, another concept that we often talk about trying to prioritize in public health and in maternal health is access. And we know that when we talk about access, a lot of times people go to this very physical concept of being able to touch a particular service or provider. Can you talk a little bit about what access means with the birth justice framework?
For me, access is bigger than just having a space for people to get care, because definitely at moments in time there was question of whether or not there was access to care in DC. There's always been access, but people weren't engaging in that care. That's the question. Why aren't people going to where the care is available? To me, access means individuals receiving care from folks that look like them. So that I'm talking about cultural congruence and how that is automatically a way to de-stress individuals, not having to code switch, not having to feel the pressure of worried about bias that they may be engaging with. To me, access means providing care without systems that are punitive, making sure that late policies are pretty much broken. We gotta meet people where they're at. To weekend hours, to night hours, to identifying what people are asking you for and trying to give it to them, not building systems on what's easiest for us. So to me, I can keep going, but access means a bunch of things to me.
And I just want to really echo what Ebony's saying, that it's more than brick and mortar. You can put 1,000 clinics east of the river, and if folks aren't getting the care that they deserve when they show up, you have done nothing. You have wasted your time. And so we really need to broaden what we're thinking about, what we're talking about, and what we're hoping to achieve, and ground that deeply in our values. I think this question around cultural congruence is a really important one and an under-focused issue, right? What does it mean to show up to a provider who looks like you? To care for communities and to show up and for a Black woman to be cared for by a Black doctor is a big deal. And so we need to understand that to show up and have someone who speaks your language, who comes from where you come from, is a big deal. And so we need to really invest in our training programs so that we can understand their lived experience and value them. And I think the last piece that I'd say about access is really around what our responsibility is as providers and how we need to shift the power dynamic that is inherently built into our systems so that they go back to the person to whom they belong, which is the individual that's seeking care. Our systems are designed to disempower folks that are seeking care. And as both a doctor and a patient, I see this play out in all kinds of ways. And me being a healthcare provider, knowing that I hold a lot of power and privilege that many folks don't, and still feeling consistently disempowered in healthcare systems. When you are disempowered, then survival is key, and your ability to focus on all of these other intricacies really decreases. And so how does power play out in our systems, and what is our responsibility as healthcare providers, as folks with power, to ensure that that power remains with the individual?
Thank you. So you mentioned some of the legislative work that is going on in this space, and I'm wondering if you could share some of the other things that are emerging in this space, whether it's in the advocacy space or in education, that our audience that is watching and that's here today can look to learn more and see what's emerging. And that's for anyone.
I'm happy to start. So the organization that I run is a physician advocacy organization, but there are lots of other advocacy organizations that really understand what we call the power of the white coat privilege, right? There are spaces that as a physician I'd be allowed to enter that many in the community that I serve and I come from would never have an opportunity to enter. And the question becomes, what is my obligation when I show up there? And for me, that obligation is to always bring community with me and to prop that door open with my foot and make sure that I'm bringing as many folks into the table as possible. And so the advocacy work that we see from medical students, from nursing students, from midwifery providers, from physician providers, to really ensure that the voices of the communities we care for are showing up in these conversations around policy and legislation, and whenever possible, to the degree possible, making sure that the patients aren't talking through me, that they actually are the ones who have the right to be sitting there and telling their own story. And that's a huge part of the advocacy work that we see. We need to make sure that those that are making laws and policies know that there are real people at the end of this legislation that will be directly impacted by this decision making. And so that's the work that we do at our organization and the work that I know a lot of us do around advocacy.
Dr. Jeffers, Emerging Trends.
Yeah, I mean, I mentioned previously the Black Birthing Bill of Rights, so I'm just going to talk a little bit more about that. I think it's important that we think about how we can sort of reimagine care, and utilizing the Black Birthing Bill of Rights provides a framework for thinking that through and providing changes at the structural level as well. So with the Black Birthing Bill of Rights, we talk about racism and the impact that that has on care. We talk about obstetric violence, how that intersects with racism, and how people are due for having mediation, for really confronting the harm that they experience on a daily basis and on a health basis as well in terms of their encounters with healthcare providers. So I just want to draw more attention to that and definitely encourage people to think about, hey, how can I incorporate this into my care as a healthcare provider? Can I print this out, provide it to my clients, let them know this is the standard that you can hold me and our institution to as well? Can I print posters, put them up in our clinic so that clients can say, hey, this is what I should expect, and know that this is the baseline of care, which is actually a wonderful ceiling as well.
And I would be remiss if I didn't talk about the birth center. A lot of people don't acknowledge the fact that the Community of Hope has the only freestanding birth center in Washington, D.C. I cringed a couple weeks ago. I was somewhere and they were like, there's no birth centers in D.C. I'm like, yes, there is. The other piece that makes us special is that we are a federally qualified health center that has a birth center. We are one of 5 left in the country. I said 5. We have a very unique model. We provide incredible care, but talking about access, talking about reproductive justice, out-of-hospital birth is often not an option for marginalized populations because of cost. We are a birth center that accepts Medicaid. We are not being utilized to the capacity that we should be being utilized. And we are actually moving, only down the street, y'all, don't worry. We're not going far. But in our brand new birth center, I'm hoping that I'll engage more of the community to utilize out-of-hospital birth. It's transformative, it's important, and again, it should be an option, especially for marginalized families.
And I guess I would love for each of you all to share with our audience and just with the birthing people in Washington, what does the future of reproductive justice look like if we were to dream forward and speak specifically as we do the work to change the ecosystem? What does the future of reproductive justice look like?
So I think from my perspective, the future of reproductive justice is intersectional, right? So when we're thinking specifically about Black communities, there's no monolith, right? We're not all the same. We're heterogeneous. And so what does that mean? It means that reproductive justice holds space for individuals that are disabled. It holds space for people experiencing violence. It holds space for people that are experiencing the impact of climate change, right? It holds space for people that are experiencing impacts related to environmental pollution. So I would love to see reproductive justice as it pertains to Washington, D.C. and nationwide, to really think about how reproductive health is impacted by all of the other issues and injustices that are experienced today.
Ms. Marcel?
I don't want it to be a hashtag. I don't want people to just commonly use it. And I also want people to be clear that it was a framework that was created by Black women, and not to be disrespectful, but just to say that not everybody can implement reproductive justice, being really honest. I want there, now that we've had all this awareness and gloom and doom, I'm looking for some more joy, some more Black joy, celebration, thriving, to be discussed when we talk about reproductive justice. We've spent a lot of time focused on a lot of the negative, so my future of reproductive justice is about Black joy.
Beautiful.
That's hard to follow. I think, you know, we all want joy and deserve it, right? And so to me, the tie in for all of these things in the future of reproductive health, reproductive rights, and certainly reproductive justice is liberatory, right? And so for me, in seeking liberation, my liberation will look different than Dr. Jeffers' liberation, will look different than Ebony's liberation. And so for me, the future means that each person has an opportunity and a right to decide what this liberatory future looks like for them, and to have the systems and resources necessary to support and truly sustain it. So freedom for me, liberation for me, may look different than it does for anybody else in this room, and still I get to decide what that looks like, and that to me is the future.
Thank you, ladies, for sharing. Dr. Jeffers, Dr. Perritt, and Miss Ebony Marcel, thank you so much for breaking this down. A hand for all of them. We want to continue this conversation beyond today and beyond this stage around how reproductive and birth justice can help us to move the needle in maternal health, and also bring us to a centered place of inviting more joy in our birthing experience, particularly here in DC. So as we do this, we want to encourage you all to continue to join us as a part of this conversation. You can join us over at Mom Health DC and utilize the hashtag DC Maternal Health to continue the conversation. Let us know what you're thinking. We want to hear about emerging trends and the work that you're doing, because we do this together. That's a part of the future of reproductive justice as well, sharing our stories. So want to thank our amazing panelists for today, and continue the work.
Yes, ma'am.
Thank
All
you.
right. Thanks, ladies.